So good afternoon, everyone, and it's a great day for us, for the healthcare fraternity, as the World Health Assembly convenes. We are an recognized side event on the World Health Assembly, and I thank each one of you for taking out time and coming. And I can tell you that out of hundreds of PowerPoints are made in 40 countries, this is the only real PowerPoint. We have a point, and powerful people are in the room. This room represents more than half of the world's workforce in health, totaling 65 billion. You will be joined shortly by Pamela Cipriano. She represents 29.8 million nurses. Catherine represents 4 million pharmacists. We have Dr. Peter Schwartz, president of ITF. We have president of ACC. We have from WHA. We are joined online by global leaders representing almost 36 million of the health workforce. And this is an important day for us when we launch this Digital Health Sans Borders. And I'm immensely thankful to Dr. Alain Lebric, my friend and colleague for 2 decades, the head of Digital Health and Innovation at WHO, for his support. The entire team of WHO, sitting here is Derek Monini, the head of Digital Health and Innovation, Salim from the leadership team of WHO. I'm personally thankful to Dr. Tedros. Though he has been extremely busy, this is the first day of the World Health Assembly. He has recorded and sent this message which we play. And Dr. Tedros has been a fantastic support for all that we have done. And I should give you a backdrop of why digital health sans borders. See, digital health has no borders. It has only got the borders we created. Today, we will erase those lines with dignity and respect through digital health. That is exactly what we are going to do. And borders should not determine who will receive health. It should be without borders. But digital health can only save lives when it crosses borders. We have all started talking about technology from the tech hubs of the world. You always hear about digital health from the tech hubs. We have to take it to village hubs. Technology is supposed to serve and save lives. That's why our mission is digital health for life. We should save life, and digital health should be with us all through life. And we are not launching today a movement of machines. It's a movement of hearts and minds. And the promise is that someone who is born in Geneva or Goma will have the same chance to be living, healing, and being healthy. That's the promise of the movement we're launching today. And we wish to bridge the digital health divide. And let me give you a brief walk through this. Today, World Health convenes with a very interesting theme, One World for Health. This is exactly the theme that we are on. Most importantly, if you look at that everyone should have an equal chance to live a healthy life. That embodies in the mission of Digital Health Sans Borders. And I wish to walk you through the history of how this was born. In 2017, I was serving as advisor to the Health Minister of India, and I wanted to launch this service called Doctor on Call. 650 million Indians live in villages with patchy network of health services. So I met the finance joint secretary and I said, would you sanction the money for this? Because even if it's the ministry's project, the Ministry of Finance is supposed to sanction. And he said the file has been waiting for 4 months. And I sent him this email, I think on the 14th of June 2017. Then I sent him this news. This man is carrying the body of his niece and she died of diarrhea, which is preventable. And these are real stories of how this movement was born. And finally, I wrote in the national health policy, which my boss, the health minister, asked me, and look at what has happened in India. We have now the world's largest digital mission. This data is from today's morning, 777 million health IDs created by the government of India. If you look at the numbers, 545 million health records linked to Ayushman Bharat. And if you look at the numbers, they're staggering. Not only that, we created the world's largest telemedicine platform. So when I come to say that we want to launch Digital Health Sans Borders, there is a history and there is a proof it can deliver. We have done 373 million teleconsultations. Yesterday, it was 253,000 teleconsultations. So anywhere in the country, any language that you have, you can get to consult a doctor in your language. And when the doctor replies, he replies in your language, he is hearing in his language. That's the level at which the maturity of technology is. In 2019, I wrote this cover story globally, digital health from hope, hype, and halt to hope, hype, and heal. We should heal with that. And the genesis of this started with the minister from my Prime Minister's office when I told him that we want to launch the program Digital Health for All by 2028. And you know why it is 2028? Alma Ata achieves 50 years. And we promised people that by 2000 we will achieve primary care for all. It's 25 years since then, and we are not there. At least we can promise digital health for all. And now with SDGs culminating in 2030, all the more reason. These are real representation of scenarios on ground. Why should a woman in Malawi go to a clinic to find it closed and people die? Why should someone carry a baby in a South Asian nation to go to a doctor, going miles and the roads are like this? These are real life depicting scenarios. The images may not be real, but they depict the real scenarios. Why should a refugee, go to find a prescription to buy a drug? That's shocking. And someone crying, a sobbing heart and tearful eyes to get care for their parents. And this is possible with technology. Someone with a broken thermometer in a remote Mongolian village. Now this slide gives you a sense of the divide that we have. So the first one that you see is our data of the multilateral body that says more than half of the world population doesn't have access to care that they need. And look at the other side, it is the internet coverage. In today's time, we need to bridge this divide. Anyone who has access to internet should have access to health. And various studies that we have done in building up to this movement, we lose still 10 million lives with preventable causes, which technology can save. And you can look from the kind of interventions we need and the amount of lives, and this is quite an underestimate if I were to say. The real numbers would be very high. Non-communicable diseases, 4 to 5 million. Maternal and child mortality, almost like 1.5 to 2 million. Infectious diseases, 0.5 to 1 million. Medication adherence and diagnostics, half to 1 million. Emergency response and trauma, almost still 500,000. And these are the positive stories. So on one side you see the divide that leads us to lose life. These are the real scenarios, and I'm not giving you made-up cases. How in a remote village in Peru, telemedicine gave back a mother to a son. How in a war-torn Syria, AI chatbot saved a life. This is a case where someone who was coughing was asked to get a check done, but the X-ray was read by someone who said, you do not have TB. A second opinion was done through a teleconsultation. He was diagnosed with TB on time to be cured, saving the family and the community. So we launched Digital Health Sans Borders. The goal is that if we have technology, we should be able to save lives and serve lives. This is also the Geneva Declaration of Responsibility. We have to be responsible. I think people sitting in the room, we have worked to invite every single person sitting in this room has the potential or is already changing the face of healthcare in the world. So just imagine, I keep saying, if we are privileged, we should know that we are privileged. Out of 8+ billion people, not everyone has the opportunity to sit in Geneva and talk about this divide and in a position to do something. Each one of you today represent the potential to change and serve lives. Even before we started this movement, we have organizations that have signed up to say that we will volunteer time and expertise to people who need it when they need it through digital platforms. And I'm sure the movement will grow with your patronage. And I'll stop here. Thank you. I think big round of applause for our WHO team. Even sitting in the room, I have Derek, Monini, Salim, Pascal, Samir, everyone in this room here. Thank you all for putting digital health and giving it the rightful place.